Sure. Okay, so I can make up time on this speech, but I wanted to give a very practical, pragmatic overview of Ravicti because it is a confusing, there's so many moving parts with this drug, and I just wanted to give the dummies version. So as you know, one of the SLC patron saints, Caddy King, has been studying the drug for a long time and found it worked for SLC6A1, and another patron saint, Dr. Greenspan, was able to begin an investigator-initiated trial. The trial was and still is very promising. We've gone over the pros, but the biggest con is the cost. And just for funsies, Dr. Goodspeed prescribed it to like my local Kroger, and I'm not joking, that's my text response. Your estimated copay is $56,942.99. Okay, so what I like most about Ravicti from a patient person type standpoint is that it's not a dirty drug. It's not like Depakote. It's not like Keppra. I'm so afraid of Keppra, I don't even want to say the word. It's like Beetlejuice after you hear the stories of behavior. And you can get it prescribed and like the pharmacist doesn't treat you like a drug seeker. Now, there's a chance of acidosis, but it's easily addressed. Our kids already take so much medication. Just give them some bicarb, like things will be fine. And big note, I'm oversimplifying, adding exaggeration for dramatic effect, but you get my drift. And because it's so expensive, around $850,000 a year for a child the size of Maxwell, it's one of the most expensive drugs in the world because it's $850,000 a year into perpetuity. The drug has gone generic, but as expected, the price declined 10%. So thanks a lot. What this means, yes, insurance might be more inclined to cover it, but you can still expect a lot of denials because we're using the drug off-label. So, because we're using it off-label, the most obvious question is, can you put it on label? Can we add an additional indication to the drug? Well, I'm so glad you asked. Hundreds of hours. No, not easily. You need a drug sponsor. If the company who owns the drug doesn't want to expand the label, which in this case, it makes no sense for Amgen to expand the label. It's generic. This isn't gonna make them money. Like, they're moving on with their pipeline. I support their decision. I understand why. And it's also not going to be profitable because it's generic and there's no mechanism to add an additional indication to a drug that's generic. There are some substitutes. One is sunbutyrate. It's kind of my favorite one because it tastes pretty good. But, oh, and you can buy it off of Amazon. Now it's sold out because everyone that couldn't get Ravicti is drinking bottles of sunbutyrate. and also we'd get a good idea of how it's made, but it's a supplement. So it's not GMP manufacturing standards. You just don't know. Because of these reasons, and because of cost, having a trial for something like this is really, really difficult. Ideally, we would want to control that supply chain some way, but it comes down to a question of time for the nonprofit. Do we spend all of our time trying to figure out how to make a supplement and still be broke, or do we spend all of our time working toward a gene therapy and still be broke? access still remains really difficult, and it's frustrating. The feedback I hear from doctors, we want more published research. Well, Dr. Greenspan is working on it. He knows that his house might be torched. We won't do it, I said I was exaggerating. But the price of the drug raises so many red flags among the medical community. Like, everyone's like, oh, whoa, wait a minute, what's this? And you can go into the history of the drug, but it doesn't matter. The optics just look really, really bad. And another super frustrating point is that the FDA doesn't allow price to be considered into practical conversations, like toxicity, like the cost of monkeys, or that there's a shortage or whatever. You're not allowed to bring that up. And you also can't engage with the FDA and say, listen, I want to add an additional indication for a generic drug because it works, and we just need insurance coverage. That's an invalid argument to the FDA, because they're like, it's not that we don't want to help, it's just that that's not what we do here. We have a sponsor, we test drugs, we allow them to be distributed. I think things will get easier with an ICD-10 code, but realistically, I think it's important to note that, like, we've done a lot of research for this drug. We need more peer-reviewed publications. We can continue the trial, but patients are going to need to purchase their own drug, and it's going to be around $20,000 a year, not the $850. That's a totally different presentation someday, but that's with a clinician like basically donating their time, and $20,000 a year is still a really heavy lift for the families. My ultimate wish is just that doctors were less afraid and would just prescribe it. Try it, it washes out quickly. Like, we take much larger risks often. Anecdotally, I hear that patient doctors who are willing to fight with insurance are becoming more and more successful. And I think it just comes down to, if this were a cheap drug, would we really be spending so much time debating the effectiveness? Like, if this were Prozac or something, everybody would say, oh yeah, I mean, geez, yeah, try it. It also annoys me because there are other chemical chaperones. Like, one hit that always comes up for SLC is menthol. And this was soon after Maxwell was diagnosed, but I had all the smart people on the phone and we were talking about menthol, and I was like, okay, so what do I do, like, to get it into him? That's accessible. And everybody was silent, and I made the joke, like, should I go get him menthol cigarettes? And cigarettes break the blood-brain barrier. Do I cover him in Vicks VapoRub? And obviously it's frowned upon to teach a 3-year-old to smoke. But somebody on the phone was like, you could try Vicks. And in my head, I was like, oh, I mean, look at him. He already has all these problems. He can't smell like that in kindergarten or 3 years old. Like, we can't walk around the house smelling like Vicks VapoRub all the time. And so it's kind of a similar argument with these chaperone drugs. Like, I would really like to take the cost of Ravicti out of the equation and say this is a safe drug maybe it makes more sense to take more time to just fight for it with insurance rather than have parents start taking drastic measures like Marlboro menthols. I don't smoke, so I can't think of a brand name. Oh, and I was also going to make the joke that if we go that route, next year we should meet at 7-Eleven for the conference and save a lot of money. So again, I've explained the quandary pretty well. We've funded nearly $350,000 in studies for a safe FDA-approved drug. There is no pathway to add an existing indication. There is no central authority for insurance coverage. The compendiums are the closest thing we have, and I think Dr. Greenspan is doing a fabulous job at getting them in. And again, I just want to ask ourselves like the very practical question, how many additional studies are practical just because of the sheer cost? And Dr. Greenspan and Dr. Demarest are going to be busy with that UCB natural history study next year. And if I had a choice between one or the other, UCB. And lastly, we can't control the timing of publications. And so when doctors ask, we're at the mercy of waiting for that PubMed alert too. And that is my presentation.